The World Health Organization has confirmed the first fatal human case of the bird flu. And joining us for more now in a health checkup on this Friday is Dr. Iris Gorfinkel. Dr. Gorfinkel, good morning. Okay, this happened in Mexico, and up until now, this flu had only been reported in birds. Just fill us in, if you could, just how concerned should we be?
Right, it's always concerning when an avian virus infects a human. And why? Because humans don't have any immunity to avian flus, to avian viruses. It's a first. So generally speaking, when a bird flu infects a human, the mortality rate is high. And this poor 59-year-old man who just happened to win the bad lottery of having a neighbor, well, not immediate neighbor, with avian flu, he died from it actually, but he had lots of other comorbidities and was sick to begin with.
What protections do we have for something like this? Do we have a vaccine?
No, Canada does not have any vaccines, but we have to think about it, right? Because in a few short years, millions of birds became infected, and we've seen this virus jump from birds into mammals, including dairy cows. Some 100 farms in the U.S. have been affected already, although we haven't seen it here in Canada. It could certainly happen. And other mammals have been infected too. So at what point do we say it's not them, it could be us? So yeah, there's been 3 cases of H5N1 in humans so far, but why would that change? Like, it could change, right? There is no human-to-human transmission so far.
All right. Meantime, the World Health Organization also out with some urgent new warnings when it comes to this streak of record heat that we've been seeing, particularly for the most vulnerable. What is your advice, doctor, when it comes to dealing with high temperatures and humidity?
Yeah, recognize the signs of heat exhaustion and heat stroke. So the body first sweats it out, and it does a good job of keeping the body cool. But then when the temperature goes over 37 degrees, we start getting uber thirsty. The skin becomes cool and clammy. Somebody might start feeling a little woozy. That's the dehydration part. And then what happens? The temperature can go above 40. And that's nasty. That's a reason to call 911. The person starts getting really confused, a super bad headache. And that's, what can we do? We've got to keep hydrated, keep cool, cool compresses on the forehead, helping that sweat along, cool baths if necessary. AC, but what does that do? Add more global warming. So it's kind of a nasty situation we're in.
Yeah, but there's some good advice there as we head into the summer months, for sure. Okay, there's a headline regarding new guidelines that have been released regarding vitamin D.
Yeah, a lot of us are low. So first thing the guidelines say, and let's preempt that. Do I need my levels checked? Answer, no, you do not. The new guidelines say, and this is from the Endocrine Society, no, you should not check your D levels. Now, what about who should take it? Pregnant women are recommended to take it. Kids 1 to 18 years of age should take it. These are the guidelines. People who are 75 and above, and people who are pre-diabetic, those with impaired glucose tolerance. So ask me, how much should I take? 600 international units if you're less than 80, and if you're more than 80, it's 800 international units of D3.
Okay.
All right, so a supplement should people look at?
Well, ideally it'd be in food form.
Okay.
So remember that cod liver oil you used to love so much? Well, that's one of the sources. You got fatty fish, you got egg yolk. Those are good sources, but it's hard, right? Because in Canada, we go out wearing our clothes and we're covered with sunscreen, and so a lot of us are not getting the vitamin D3 we need.
That is required.
So maybe stop wearing our clothes?
You said it, not me.
You go first, Jeff.
Yeah, no. I'll go with a deficiency in vitamin D as a favor to all of you. All right, the term Ozempic babies has been trending. I want to ask you about this morning, doctor, as women are sharing stories of getting pregnant after using Ozempic. Are Ozempic babies, is that a thing?
It is a thing. So what happens is that women who are really overweight are less likely to ovulate regularly. So what happens? They lose the weight, and then they start ovulating regularly, and then the next thing you know, a woman who wasn't getting pregnant can get pregnant. So I'm not suggesting that that is the solution to all women who are suffering from infertility, but a segment of them. So here's the rub. They're not supposed to take Ozempic when they're pregnant. And in fact, the guideline is to stop 2 months before trying to conceive. But there are so-called Ozempic babies. Nobody's giving babies Ozempic, but I just say that babies born as a result of women having lost the weight.
Okay, there we go. The Ozempic babies explained. Thank you, Iris.
Thanks for having me.
Have a great weekend.